The new CCMI Mark III has been redesigned with new features to make it easier to use. The patient's knee width is obtained by pushing the load plunger and viewing the measurement through the window as shown here. The patient's varus valgus angle, or lateral offset, is measured in this manner as shown here. Another new feature is the retractable measuring tapes located here to measure for short or standard thigh and calf lengths. Mobility and protection of the CCMI Mark III is important, so we've upgraded the carrying case. The foam-filled case includes order forms, a DVD with instructions for measuring and fitting, and contour paddles. To unstow the CCMI Mark III, simply pull up on the swing arms and rotate them outwards. Pull apart the knee width caliper and position directly on the patient's knee. Arrows on the condyle shells should align with the top of the patella and slightly posterior to midline. Be sure the condyle pads are sitting just above the femoral condyles. For standard thigh or standard calf measurements, extend the retractable tape measure marked in inches most proximal to the knee for the thigh and most distal to the knee for the calf. Wrap the tape measure around the thigh and secure it to the hook on the tape module. Press the tape release button to pull the tape measure snug to the thigh. Ensure the tape measure is parallel to the floor. Repeat the same procedure for the calf measurement. The lateral outrigger should now be flush with both the thigh and calf and positioned at midline. For short thigh or short calf measurements, follow the same procedure except use the metric measurement tapes located just above and below the knee. Remember, where the calf tapes lay on the calf will determine if the patient needs a standard or short brace calf cuff. The desired placement of the calf cuff will be at the belly of the calf muscle or above. To establish proper knee compression for knee width measurement, support the lateral side of the instrument and press the load plunger on the medial condyle until the triangles are aligned. This assures an accurate knee width measurement. Record the patient's knee width, lateral offset, and thigh and calf circumferences on the order form. To record thigh and calf contour measurements, insert the steel shaft of the contour gauge into the snap feature on top of the tape module. Next, wrap the contour gauge around the anterior thigh, parallel with the floor, being careful not to compress tissue. Record the readings in each dial window starting with dial number 1. For dials number 4 and 5, you can simply rotate the instrument away from the patient's groin, then take the measurement. This will make it easier to read. When finished, remove the contour gauge and repeat the procedure at the posterior calf. You are now finished measuring for a DonJoy custom Defiance brace. Please note, it is not recommended to measure patients shortly after surgery while the knee might still be swollen. You may have the opportunity to measure a patient prior to their surgery. Once you've received your custom Defiance brace from DonJoy, it's important you follow the correct application procedure for the brace.